How can I help?
It's getting worse and better.
Oh dear. My leg's been that bad and I've been that painful. I've like days where I can't even get up out of bed where I'm hurting that much.
How good are you at sticking your tongue out really far? How wide can you make your mouth? Oh, that's pretty good.
The new tablet can cause urine infections and it can cause thrush.
Oh, lovely.
That's quite painful now.
Well, you poor thing. Well, it's obviously you're going to need to go to the fracture clinic.
Right, OK.
Morning.
Thank you for waiting.
My grandson's just had a coughing fit where he couldn't breathe and all his chest is hurting.
OK. What's his date of birth?
Date of birth, Mark?
What, 2000?
22nd of May, 03.
Yeah.
You're supposed to know your own flipping birthday, you twit. Have a seat.
Thank you.
Oh, dear. Right, that's a big sigh.
Oh, yes. I was here last Tuesday.
Right.
That's with a UTI.
Yeah.
So I've had it before, but
Right.
this time was different. It was so painful.
Right.
So I came to the doctor, and then she prescribed for me some antibiotics.
Yeah.
And then she said between 2 to 3 days it should begin to clear.
Yeah.
So today was the last time I took it.
Yeah.
But I still feel pains.
So the urine sample that actually went to the lab, it didn't grow an infection. OK.
OK.
So...
So what's it then?
So, Dr. Bolam did dip it and it did show white cells. So any discharge or anything down below?
No, not that I know.
No. Any new sexual partners at all?
No, it's only my husband.
Right, OK, OK. Could you do another urine sample for me now?
Yes, I can do that.
Saying that. Oh, one last bottle. If you go and do that and then come straight back in.
Right, I'll do that. OK, thank you.
Come on in.
Thank you.
So this is Max.
It is. Well, we're here today because he's got a sore in the corner of his eye. So it's got to the point now where he's sort of not even sleeping properly because it's bothering that much. Like the other night we were up for 6 or 7 hours with him where he was just... Obviously, I presume where he was in pain with it, but we have rinsed it out with some salt water. It was a little bit...
So we're talking
not
about...
pussy. Yeah, there's a little, like, in the corner of his eye. There was a little bit of gunk, but I'm afraid that he's rubbing it into his eyes. Yeah. He's going to get an infection in there.
Hello. This is funny, isn't it?
What's going on? It's sort of catch-22 because he's not sleeping, so he's rubbing his eyes because he's tired, which is then making it worse, sort of thing, you know?
You know what? What I'm going to suggest is if I give you some drops, say keep the prescription,
right.
Watch it over the next 48 hours, and I'm sure it will be getting better.
Yeah.
But if it isn't,
right, okay.
That's the next thing to try.
Yeah, OK. I know, mate, I know. I just obviously worry because his eyes is precious to him.
Yeah. I don't think there's anything really serious going on. I think that's the first and foremost thing. So keep doing what you're doing. Next 48 hours, I'd expect you should be, if not home and dry, very close to it. Okay. If you're not, then you can get that from any chemist.
OK. Thanks for your time. Yeah.
Sweetheart?
I have to find my patient.
Oh, unless he's gone in the toilet. Oh, I don't know.
Oh, I've lost him.
He's in a blue top, I remember, yeah.
Oh, right, he's not upstairs in the upstairs waiting room, is he? Because somebody's just come to collect him. Thank you. Bye. There's a gentleman there. Hello.
We've lost all the doctor. OK, brilliant, thank you.
I couldn't pee much because I did try
That's plenty, that's fine.
The sample that the doctor took, she asked me to call the lab to find out whether it's in. Are the results in?
Yeah, well, that's what I said,
Oh, okay.
that it's negative. When she dipped it, there were the white cells in there and blood. Right, so there's 1+ of blood and 1+ of leukocytes again. So we'll send it off again. OK, if you jump on the bed, can I have a little feel of your tummy? Just pull this round. OK, so where's the pain?
Here.
Yeah. A little bit there. That's quite sore there, isn't it?
Yeah.
OK, you can pop your stuff on.
OK.
Most of the time, when we treat a urine infection, when we send it off to the lab, we would expect to grow bacteria. People can have infections in their urine or in their kidneys without it showing. OK. So I feel it's probably worth us treating you with some further antibiotics as you're still symptomatic. OK.
That's fine, thank you.
There we go. I hope things improve. Drink loads as well. Yeah.
Thank you.
OK, but if it doesn't get better, do come back.
Thanks.
OK, no problem. All the best. Bye-bye.
Thank you. Bye.
Kerry Rich. Hello, hi there.
Hi.
Come on in. You look in the wars.
I have been.
Poor thing. So come in and have a seat.
Thank you.
Yeah, so I'm Dr. Lee now.
Hi. So I came off my bike last week.
Oh,
as you can
yes.
probably tell.
Yeah.
So I was taken to Southmead. They did lots of X-rays and everything. Nothing's broken, which is good. But my shoulder has given me quite a lot of pain. They said there's nothing wrong with it. There's no break. But as you can see, the bone is in a funny place. And it's just really painful.
Can we just put your hair back?
Can't reach very far with both hands. My chest is really painful.
Is this a push bike you are on?
Yeah.
Wow.
It's really tender.
Can you move that up?
I can move it holding it, but I can't move it on its own. So that's quite painful there.
Can you come across your chest?
With help, I can.
Again, yeah, but
Yeah,
okay.
not on my own.
And I'm not even going to attempt to put your arm behind you.
No, I can't put it. I can't sort of put a cardigan on or.
But it looks to me as if the shoulder is dropped right down. So I'm sure. Did it look like that when you came out?
Well, I was laying down.
I suppose you were a bit out of it.
I was laying down the whole time I was there. So I'm wondering if they actually realised it was looking like that. Obviously, I know it shouldn't look like that.
No, it certainly shouldn't.
I'll be really breathless.
Really bad breathing.
I might just take your peak flow today and just see.
Take a deep breath in, see your lips round and
blow out as hard and as fast as you can.
As if you're blowing out candles.
Stand up for me and give me a good blow in there.
That was awful. Gee, that's not bad.
Give it a really short, sharp blow.
As hard as you can. Great.
Hello.
Hello.
I'm Dr. Bolam.
Good to see you.
Right.
A week back, I was here.
Yeah.
I was suffering with every year almost a fever.
Okay.
Apart from that, I'm having asthma.
Yeah.
So it's getting worse and
Oh dear. Okay. All right. So you think this is really your asthma, or a combination of the
combination,
asthma?
yeah, because
all right.
it triggers with. I mean, asthma. It's in control.
It's not in control at the moment, is it really?
Almost every summer.
You always get a bit of a dip.
Starts with hay fever.
Okay, and then your
ends
asthma.
up Last year I was been to the emergency. Then my GP. He said like we'll try with antihistamine, which I'm trying over the counter.
Yes. Okay. So what you're wondering, I mean, I'll have a little look at you in a minute, but what you're wondering is whether you need the steroids.
Absolutely. That will give immediate relief and controls life.
Right. Okay. Well, I will anticipate we'll do that, but let's just check. Okay.
Okay.
Can I just pop this on a finger? And you're not coughing up any spit. You don't think you've got an infection or anything?
Spit in the sense, white stuff sometimes coming, but
yeah, but nothing green or not mucky looking. No. All right. Okay. And what job do you do?
I'm an IT programmer.
Okay. Right. Can I have a little listen to your chest? Is that all right?
Absolutely.
Thank you. Okay. Okay. I'll wait till that's finished. You're a bit wheezy, aren't you?
Yes, absolutely.
Do you have a peak flow meter at home?
Yeah.
Might be better to stand up. Let's just have a look what your normal peak flow is. Do you know what it is normally?
I'm sorry, I don't remember.
I feel like coughing now.
It's not contaminated. I don't think it's contaminated.
I don't think you contaminate. I think it's psychological. So the last time you did it was 420. Okay. Well, a quick glass of water. Just blow it over that direction for me.
Oh, I just hold it.
That's better, I guess. No, 260. All right, so that's a bit lower than you were last week when you saw the nurse, all right?
Yeah.
Okay. Okay. I'll give you some... so the best you did there was 270. All right. If I was you, I think I'd be carrying water around with me. I think water would help a bit, wouldn't it?
Yeah.
Maybe we need to step up your treatment. There are options, but you think it's well controlled most of the year, and it's just bad in the hay fever season, really?
Season in summer.
Okay. All right. Fine. I don't want to step it up permanently if it's normally all right.
Yeah.
Okay?
Thank you very much.
All right.
Cheers.
That's a pleasure. Okay. All right. Take care now. Thank you.
Thank you.
Bye-bye.
Where you come up to the waiting room, there's a door in front of you, and the health education is right in front there. But when I phoned her 10 minutes ago, it wasn't open. It may be... Oh, she's there now. She's going to come and collect you. There you go. OK. Take care. You're a bit flooded here. What she said. They're all a bit mad here. She's probably right with that. Tell you what, it gets you through the day a little bit quicker.
Neck sprain.
They didn't say that to me.
Oh. I think they completely missed it, actually. I mean, I presume that because the clavicle isn't fractured, because the collarbone is not fractured.
Yeah.
They've obviously. Are you all right to go down?
Yeah, I just. Oh. So I'm wondering, because I was like this the whole few hours I was there, if they actually.
Yeah. OK. Well, you poor thing. So I think obviously you're going to need to go to the fracture clinic. Are you all right? Can you help?
I just need a bit of help. Thanks. Thank you.
What about your face? How's that?
It's fine, yeah.
Is it?
I know it doesn't look it, but it is.
Bikes are so fabulous and so dangerous when you come off, aren't they?
I know. I went back to see where we came off today. We measured it and we reckon I travelled about 100 feet from where I left the bike to where I landed.
How did you come off?
The chap in front of me came off in a pothole and I was right behind him. Yeah.
Really difficult. Let me
So we'll have to wait a long time for this?
No, they run them every day, actually, so I'm hoping we can get you up tomorrow. Let's see. Yes, hello, it's Dr. Liz Lee here. I'm a GP at Hawford. I've got a patient who needs to come to the fracture clinic tomorrow, please. That's marvellous. Thanks very much indeed. Great, bye.
Brilliant, thank you.
Well, that's good. So what did they put on your sick note, actually? Shoulder injury or...
Oh, I'm not sure.
Well, I'll put shoulder injury, because that's the thing now. And if I give you 14 days, because I think it's going to take a little while, isn't it, this? So that's 2 weeks.
Brilliant, thank you.
It's gone, but you better wait and see.
Thank you
Well,
very
you poor
much.
thing.
All right, thanks.
Okay, okay. Bye-bye.
Rocco?
I'm Rocco.
Have a seat. Cool, that one's a bit fresh, isn't it?
Yes.
When was he born?
He's just over 3 weeks old.
3 weeks?
Yeah, born
You a
last
big
month.
brother now?
Yeah.
Big brother? How are you then?
He's complained of a sore throat. I can't really see in there. I've had a little look. It feels like his glands are up a bit. He's had a temperature for a few days.
Okay.
Keeps going sky high, but because he said his throat's sore, I thought I'd come and get him checked out.
Okay. Can we put your finger in there? Be careful it doesn't bite you, like a crocodile. You had your temperature done with one of these before?
No.
No? Right, it goes beep, beep, beep in your ear. Is that okay? Ready? Oh, you are a bit warm, aren't you? 38.4. So how long has he not been well?
Probably since about Sunday.
Oh, how did it start?
Just the temperature, that's all I've noticed for the past few days, and he's been saying about his throat hurting.
When did his throat start hurting, did he?
A couple of days ago.
Right then, should we have a look in your throat? How good are you at sticking your tongue out really far? How wide can you make your mouth? Oh, that's pretty good. Right, look at me. Head back a little bit. That's it. Go,
Stick it right out. You've got to, darling, so she can have a look at the back.
It'll only take a second. If you do it
really
quickly.
Go on. We need to have a look to see.
Tell you what, we'll try it without this, OK? Stick your tongue out nice and wide again without this. You hold that. I promise we won't use it. If you've got hold of it, we can't do it, can we?
Stick your tongue
Open
out.
wide. Head back. There's a few little white spots there I can see. Tiny ones. Right. Let me have a feel under here. Does it hurt under there? Is it OK? OK. Right, let's have a quick listen to your chest. Can you lift your T-shirt up for me? You had one of these before? No? Right. Big, deep breath in. That's it. Oh, brilliant. And again. Oh, you're good at that, aren't you? Wonderful. OK, so his chest's lovely and clear.
Good.
I think he's got tonsillitis, so that'll be why his throat's sore, and he's got high fever. So Calpol, but ibuprofen is going to really help take down the inflammation and help with the pain. So give him ibuprofen with his food 3 times a day, plenty of water, and do you know what the best thing is for sore throats? Ice cream. What's your favourite flavour of ice cream?
No. Bubblegum.
Bubblegum? They make bubblegum flavour
Yeah, you had it last night, didn't you?
Maybe you might be able to have a bit more bubblegum ice cream tonight. You think that would help? Yeah. Yeah, so just plenty of fluids, paracetamol, ibuprofen. If you think he's getting a lot worse, give us a ring before the weekend. Ask for a telephone consultation, and we'll have a chat, and we'll probably do some antibiotics at that point.
Sure.
All right, what are you doing this afternoon?
You going to your sisters?
Yeah.
Yeah?
Yeah?
Nana's got them, hasn't she?
How old are they?
9 and 7. 1 boy and 2 girls.
No, I've got 2 boys now.
Now 3 boys.
Oh, and Dad.
Yeah.
Yeah.
That's a big, busy house, isn't it?
We've got a crazy house, haven't we? Yeah, a bit crazy.
I read in the toilet and the bath.
Are you weed in the bath?
Right.
Right, let's go. Thank you
All
very
right.
much.
Take care.
And you, bye.
Hello.
I stabbed my toe a couple of days ago. It's a really hard, vicious, angry looking, and it's so painful. I can hardly flip and walk.
You think it's infected, do you?
I think so. It's really, really painful. It's only small, but it's really sore.
So what are we looking at, another week?
Look a bit brown. Where have you been?
In the garden.
Ah, I'll have to go there.
Donna? Hi there.
Hi there.
Come on in, have a seat. How are you doing?
Bit better. Not much.
Right.
Financial side of things is slowly getting back together. I went to a job centre Monday. They've now decided until my court date comes through, I can now go back on my ESA on the condition that I have sick notes to cover me.
So so it's an appeal for the benefits, essentially. That's what the core tissue is. OK. So do you need me to do a certificate today for that? Yeah. OK. So we're going to put drug addiction therapy on, because that's what I wrote last time. Yeah?
That and chronic pain.
Yeah. OK.
Donna has had problems with chronic pain since her mid-teens and was initially prescribed opiates by doctors, and then she acquired more illegally. The script that she has from me is for a drug addiction therapy, but it is also treating her chronic pain. She could come off her opiate medication, and this might help some of her symptoms, like agitation, fidgetiness, but she has been reluctant to do this.
So I'll print that off. And then your scripts, they are going to run out, aren't they?
Yeah.
So at the moment, you're on 16.8 milligrams altogether. Yeah? And what are your thoughts about that?
As it is.
Yeah? And are you using on top at all?
No.
Not needed.
Just, but I'm not doing it now.
Right.
Oh, I'm not doing it, I don't know.
Right.
I've had some really bad nights with my legs. It's not so much my knees, it's my legs.
Yeah.
I've got to a point now where I'm sat there in the night time and I'm crying where I can't sleep because I'm tired and I feel like I just want to cut my legs off or just do something with my legs.
I need a kind of certificate to say that I'm proper ill.
You self-certificate for 1 week anyway, so the doctor won't give you a sick note for the first 7 days.
Are you full-time? Do you think that a sick note for the next few days will be enough?
I could do you a sick note if that would be helpful.
I don't want to get in trouble. They asked me for another one.
Oh
I know, it's crazy.
10 weeks I can't work.
10 weeks?
Yeah, because of this.
So you went to the pain clinic and they really helped you with your pain management, didn't they? And you went and had lots of advice.
Like I said, I went and done a thingy course, pain management course, to help obviously pace, manage. It's hard when you've got kids in that range.
Yeah.
I do it every now and again. My leg's been that bad and I've been that painful over days where I can't even get up out of bed where I'm hurting that much. I've just completely packed gymming altogether.
Yeah.
I am trying to get myself back up there.
Yeah. That would be good, wouldn't it? My feeling is that you're on quite a lot of medication. It would be best not...
I don't really want to go on anymore.
No,
I really don't want to add to the hurt.
I agree. And also, I'm not sure it really helps. The kinds of things that help are you taking a bit more control of things, isn't it?
Which is what I'm trying to do.
And is your partner still being released in the autumn?
October, a bit of luck. October.
Right.
17 weeks and counting.
Oh, really? OK.
I kind of really need him at home to help me.
Yeah.
I'll say some days is a struggle, some days I just haven't got it in me at all. It's like I'm constantly, when I'm sitting, I cannot keep my legs still because they're constantly irritating me. Yeah, because it's still swollen.
Yeah.
They haven't gone down at all. Ibuprofen hasn't took them down at all. I'm still taking them, but...
I think it's likely to be a combination of the fact that you don't do as much as you did, walking-wise, and the reason why we don't all have swollen ankles is because we use the calf muscle to pump the fluid back up to our hearts. And when you do less, then it does make a difference, OK? It just kind of pools down the bottom, and it's particularly bad in the summer, usually.
Yeah.
So maybe before you go out, you need to sit down and do those stretches first, just to kind of relieve a bit of pressure on everything, yeah? Why don't you try that out and see if that helps? OK. Was there anything else today?
No, I've been sick note, that's it. That was my main problem.
Yeah.
Slowly getting there, slowly.
Good. OK. All right, Donna?
Yeah.
So I'll see you in early August or sooner if you need to.
OK.
Yeah?
Yeah, that's fine.
Good. OK. Bye now.
Thanks.
Hello there.
Hi.
Have a seat.
Thank you.
Right, what can I do for you?
It's a couple of things. Mainly, I've got an infection in my nose. Probably about a month ago, I had a bit of a cold, quite a heavy cold, and then afterwards got a spot in my nose, and then it's gone a bit horrible, and it's quite... I kind of thought, oh, it'll clear itself up. I'm trying to leave it alone, but it's just not. It's quite hard to breathe.
OK, so it's the spot that's bothering you more?
Well, I think it's got infected. That's what it feels like. It did get much worse.
Yeah.
So to the point that my nose actually got quite red.
Yeah.
On the outside, like it was quite hard and unpleasant. But it's been weeks and weeks and weeks now, and it still doesn't feel right. I can smell it. It smells wrong.
Can you? Right.
Yeah.
OK, can I have a little look?
Yeah.
No chance anything could have gone up the nose?
Well, don't know, in my sleep maybe. But not anything like that, no. Yeah. I mean, you know, it's just suddenly when you said that, I was like, I went camping.
Oh, horrible thoughts. Oh, dear. And it's the right side?
Yeah. So I think, the spot was just like at the front.
Yeah.
Sort of, sort of in there.
Yeah.
But it sort of seems to be all around this sort of area.
Can I just feel around, first of all? Any problems there?
No.
Yeah, so the spot is quite at the front.
Yeah.
I think we should just try some Bactroban antiseptic nasal ointment.
Yeah.
I don't think it warrants antibiotics.
Yeah, that's
okay.
fine. Yeah.
Because it sounds a bit blocked, and could it be a bit of sinusitis as well?
Yeah.
But generally that resolves on its own, and oral antibiotics don't make it any quicker.
No, that's fine.
Is that okay?
Yeah, no, I'm absolutely fine with that. I'm also sorry. I'm just going to get it all out at once because I think I'm probably just need a rest. But I think I've got labyrinthitis again.
Right. How's that affecting you?
It just makes me feel low-level dizzy slightly all the time.
Yeah. Labyrinthitis is an infection in the inner ear, and this can affect your balance and hearing and occasionally cause nausea and vomiting as well. It's most usually viral, so often after a cold or flu-like symptoms, but often it eases off over a week or two.
There isn't anything, is there, apart from probably just resting and getting better?
When's that going to happen?
Summer holidays. I work in a school.
Right.
I'm the office manager in the school, so it's...
How long's left?
4 weeks.
OK. So are you looking after yourself at the moment, sort of in the evenings and weekends and resting?
Trying to. Slightly unsuccessfully.
Delegating?
Trying to. There's just a lot. It's that last term of the year, so it's quite full on. So...
What about at home?
Well, I've got 2 children, 9 and 10. There's quite a lot on for them too. But yeah, so I'm not doing that very well, and I do recognise I'm not doing that very well.
Yeah, it's hard nowadays, isn't it?
It really is.
I read something at the weekend, actually, putting a thing, a block on your email. I am not reading emails after 5 o'clock on Friday or whatever.
Well, I'm certainly intending to do that from September.
So why can't you do that earlier?
Because there's too much.
Because what will happen in September? Oh, it's the start of the term.
No.
It's.
No, you're right.
So doing more than you're meant to, I think, is the norm these days.
Yeah.
But doing it that you're feeling a bit run down, I think that's where you need to have a think. Yeah. Is there a way you could have 2 days off at the weekend?
Yeah. And have the weekend.
Yeah, because it's so
to
hard.
get the balance, yeah. No, you're quite right.
Yeah.
I mean, it's how it should be, but yeah, no.
Yeah, there we go. OK, well, I hope you cope till the end of term.
Yeah.
Be nice to yourself.
Thank you very much.
If that doesn't clear up,
please
do come back.
Lovely.
All
Thank
right.
you ever so much.
No problem. Bye-bye.
Bye.
Oh, blimey.
Sorry.
That's okay. Right then, so you come for your ischemic heart review today, yeah?
Yes, that's right.
Okay. So how has everything been? Any heart pains
No problems.
or anything? So we just check your blood pressure. Okay. Oh yeah.
Yeah, that was the last sentence. Took my blood.
Oh, shame.
I think she was next.
Ow.
No, it was just one of those days.
Yeah, it is, isn't it? I've had bloods taken before and bruised all.
Yeah, just getting the vein right.
Do it again in 1 minute, all right?
Yes, OK.
So just, and how active are you?
Oh, moderately.
Yeah.
I did go dancing on Saturday,
Excellent.
which is quite an achievement.
Definitely. What music was it?
Oh, mostly sequence and modern ballroom dancing.
Oh, how lovely. Right then, gonna do it one more time. I think
And
it's
that's my
lovely.
granddaughter, she's only 12, and she's very good. She's good at most of the adults there.
Oh, good. Can I check your weight? Is that okay?
Yeah.
$86.
What
I'll convert for you.
Yes, well, that's converted to...
Yeah. Oh, you've lost weight, actually,
Yeah,
since
well,
last year.
I tried to keep it balanced.
Definitely, yeah. 13.5 stone.
Not bad.
Good. Now, the blood results then, let's have a look. The only thing that came up was that the blood that we do that kind of looks at the amount of sugar is slightly up.
Is it?
I mean, what do you eat?
Average stuff, you know.
Yeah.
I don't take sugar with tea or anything like that, but I do eat cake and biscuits and things like that.
Yeah, it might be just worth cutting that back.
Watching it, yeah.
You know, just things that are more like sugar laden.
This is the first time I've ever been told this, actually.
So that's the only little hiccup is the sugar. So we'll just keep an eye on you. Yeah. But otherwise, carry on. Thank you ever so much.
Thank you very much indeed. There we go.
So I'll see you. I'll put it in the notes that you're to have the blood test repeated, so they know what they're doing when you come in.
Okay. Yeah,
all right.
thank
Lovely
you.
to meet you.
Thank you.
Take care.
My son, I'm not sure if his hearing's right or if he's just being ignorant.
Okay,
So.
that's fine. What's his date of birth?
Coco,
Yeah, go on then.
you're going to come this way with me?
Go on then. Hello, doctor. Here's that.
There we go. Who have you brought to see me today?
Coco.
Coco.
I think she's got hay fever.
Right.
She's waking up. When we're outside, her nose gets really snuffy and her eyes cry, but she's not crying.
Okay.
They just run tears.
Can I get that free cup? Can I get that?
Be quiet.
She's under one, isn't she?
Yeah, I took her to the chemist and they said she was too young for anything.
Yeah, it's quite unusual to see it in children so young. And when did you first notice it?
We were out. We went to a little festival,
Right.
and that's when I really noticed it. As soon as we got there,
okay,
she was just miserable. And she was fine at home, but it's when we got there, and then her eyes just started watering.
And it was it was grass and.
It was hay actually.
Hay,
There was
okay.
boughs of hay. It was it was a street.
Fine. Okay.
So we thought maybe she had hay fever.
And then since then?
Since then, it's happened again once, and we were
Okay.
out in a field.
Fine. So it's sort of it's specific to those
Areas,
settings.
yeah,
right.
yeah.
So it's pretty clear, as you say, that it must be something to do with it. Is there any hay fever in your family?
On my sister's, yeah. Blue Jay's got bad eczema, and I suppose is that all linked?
Yes.
Yeah.
Yes, it can be.
She's got really bad eczema.
Yeah. Okay. But Coco's skin's okay.
Her skin's fine, yeah.
Okay. They've kind of made it rightly more difficult to prescribe things for little ones because I think there was concern that kids were being given stuff that wasn't suitable for them.
You've got bad skin, haven't you?
Check.
Eczema, you've got.
This is hurting me again.
Let me see. Where are they hurting you to? You can't take them off yet because you need to walk on the floor.
Okay, let's have a look. Oh, actually, it does say we can use 1 milligram twice daily. And you'd only need to give it her in the circumstances.
If we were to go into like a grassy area.
Is there on the call?
Looking very serious, young lady.
Yeah.
There we go.
Thank you.
Okay. Bye. What about your shoes?
You need to put your shoes on before we go outside, okay? Yeah, we're going to go outside now in the street. Come on.
I want to just carry me.
I can't carry you. I've got to carry the sister. Thank you.
Let me do the door, hang on.
I don't want
You don't want shoes? Anyone want me to carry you?
Say bye, say thank you.
Bye.
Peter Fraley. Hi.
Ah?
Morning.
Sorry?
I said morning.
I heard you the first time.
Sorry. Just trying to be friendly, you know. It's just
Yeah,
my
I know,
standard
yeah,
politeness
as you
thing.
are.
What are we talking about today? How are you getting
Heaven
on?
knows. You told me to come back in a fortnight.
Yeah. How have things been?
Well, 4 or 5 days I felt quite bright. And then back again.
Yeah. And there was also the question about starting this new tablet from the diabetes.
I don't know anything about a new tablet.
So the new tablet is designed to try and improve the sugar control. And its side effects are that it may cause you to get some urine frequency, and it can cause urine infections, and it can cause thrush.
Oh, lovely.
And what the guidance is you drink plenty, like loads.
Yeah, I've been drinking lots.
Saying drink a glass of water every hour in order to make sure that you're well hydrated all the time.
Yeah.
But if you're OK with that, we could get this new medicine started.
Yeah.
And hopefully that will bring the sugar levels down. When did we last check the sugar level? Just give me a... April.
Was it? Oh. For months now, I get into bed at night and I get, only the top half of me, a tingling sensation in my arms and my chest.
OK, what can I do for you?
I've been getting terrible night sweats. Awful.
At night, I have to wake up because I cough really badly.
It keeps me awake at night. The pain.
I couldn't sleep at night as well because I can't put the coil on.
The quilt hurts.
The quilt hurts.
Right. So just at night, you're coughing lots.
I've had a chronic earache for the last week.
OK.
But it's getting really bad now. It's like really chronic pain at night. It's keeping me awake.
OK.
You're tired.
Where are you going to stick?
Tired, aren't you?
I just want a better night's sleep.
I get a tingling sensation in my arms and my chest, and then it just goes away.
How long does it last for?
A couple of minutes.
Yeah.
If that.
And every day, every hour, every minute?
No, only at night.
Only at night. And does it kind of shiver over you, or is it?
That's the one.
Yeah.
Yeah.
Okay. And is it all normal when I touch you? It feels normal?
Yeah, fine.
Okay. Just put your arms out in front of you, palms towards the ceiling, close your eyes. Squeeze tight, pull me towards you, push me away. That's lovely. So that's all working normally.
Yeah, it's just an annoyance.
Yeah. How bad is it? When you say it's an annoyance, is it stopping you doing anything? Or
No. Ow. It's just like you go, like that.
Yeah.
I just thought I'd mention I've had it for months and months and months.
I mean, sometimes when you have diabetes, it can affect the way that the nerves work. And this may be that you're getting symptoms linked to the nerves being affected by the sugar, because the sugar coats the nerves and stops them working properly when you get diabetes. And this may be one of those symptoms of
that's
diabetes.
what I put it down to. It's got any worse, it just comes on now and again.
Yeah.
And then
there isn't an obvious easy fix for it other than keeping the sugar level really controlled. And it would be worth us checking the other vitamins that sometimes cause nerve symptoms to make sure that they're OK when you have your next blood test as well. So
is there anything I can take to make me feel brighter?
Well, there's not a magic potion, if that's what you mean.
I know that.
Like a tonic or something like that. But getting the sugar level controlled is the
thing
best
as a
thing.
tonic.
I know.
You told me that before.
Probably did. Well, the main thing is getting the sugar level down.
That saccharin's OK to take with...
Yeah, so that's better than taking sugar, yeah.
I hate sugar, but when I have my Weetabix or whatever, I have a sprinkling of that, and that's OK.
Exactly.
So I don't want to take... I had a big Spassenberg last night, and I was a naughty boy. I know.
Oh, well.
Well...
These are the challenges of life, aren't they, though? And it's very difficult to avoid everything. I do appreciate that.
I'm quite bright this morning.
Good. Well, let's see how we get on with this new tablet. I'll see you in a few weeks' time when we can see how it's getting on.
Yeah.
Maybe a month's time.
Yeah.
All right.
Thank you very much.
See ya. Bye.
Ooh.
He's still here?
Well, the hours, yeah.
Oh, really?
Yeah.
One of those, yeah.
Puspa Patel, please. Bit of a hike down the corridor, I'm afraid. That was a bit of a mini marathon. OK. So, how are you? She's all right?
Yeah, the tablets done the job.
Done the job?
Yeah.
Really?
Yeah.
The problem she had before was the food coming back up. That stopped happening?
That stopped happening now. Yeah.
That is a good result, isn't it?
Yeah.
So we checked the poo sample and that was clear. She didn't have that bug again.
No.
So I think that the problem, therefore, is this, you can translate for me, obviously, the hiatus hernia, which they found when they did the endoscopy. If she doesn't take those tablets, that causes acid to come up and cause that problem. OK?
Yeah.
So I think she should stay on these tablets for life now.
Okay. So tablet આપી છે ને એ કાયમ માટે આખી લાઈફ તારે લ્યા જ કરવાની હવે નહીં તો પ્રોબ્લેમ થયા કરશે પાછું એસિડ. Okay.
Does she feel in agreement with that? Is she happy with that?
She's happy with that.
She doesn't want those horrible symptoms back again, does she?
No.
OK. And then she's on her calcium tablets for her bones.
That's right.
And her asthma treatment and her water pills. Well, I think that was a good decision that we made last month, wasn't it?
Yeah.
We didn't need to do an endoscopy.
That's good.
OK. And I think, you know, hopefully, obviously, you come back and see me if there's any problem again.
Yeah.
Is that all right?
That's all right.
OK.
What about him?
Does she want to ask me anything?
Puchus kasi?
I had a good days.
This is if I'm not well, I'll come back.
Of course. OK. And no trips to India planned?
No, not anymore.
Not anymore?
Finished.
No, finished, yeah. OK, all right.
Oh, she said in 2 days' time she'll be 86.
Happy birthday. All right.
Yeah, thanks very much.
Thank you very much.
Thank you, bye.
You all right with that long walk again?
Yeah, thank you.
OK,
Thanks.
all right then.
Bye.
Bye-bye. So you know where I am.
Health Centre, can I help?
It's about quality of life for me.
Yes.
And my life is not a quality life.
No.
It's like being in a prison.
What do you worry it might be?
Skin cancer.
What actually happened?
I'm a boxer.
Right.
And I got caught with a shot.
I fell onto my head.
Right.
I was paralysed neck down. My ankle went up. I heard it crunch and pop and...
We need you in the NHS for a long time. So we need to look after you.
Health Centre, can I help you?
Georgie.
Oh, we're seeing this doctor.
Hi.
Hello.
Come on in. Have a seat. So what's been going on?
She's been getting a lot of nosebleeds, but coming from just this side of the nose, but she's getting a lot of them in school.
Oh, right.
The first aider said to me today it's going on bleeding for at least 5 to 10 minutes.
OK. How often are they coming then?
She could at least have 3 or 4 a week.
Right, and how long's that been for?
Like the last 2-3 months.
OK.
One week when we was in school, she had quite a big one, they couldn't stop it.
Right.
And she said to me, well, if I was you, get her checked, because she could have a blood vessel or something like that.
Yeah, well, it's definitely a burst blood vessel, because that's what's causing all of the bleeding. Should we have a little look and see what's going on? But there's nothing, you're not feeling unwell with it or anything like that? No.
Hello.
Hi.
Have a seat.
Thanks.
Right, what can I do for Hugo?
His eyes, I've been a few times.
Right.
And I've been to see the health visitor as well.
Yeah.
And I've getting a lot of conflicting messages.
Right.
Every time I come here, the GP's told me that it's kind of normal for his eyes to be this sticky.
Yeah.
The health visitor told me it's not, it's definitely an infection.
Right.
And it's just when he's waking up from nap.
Yeah.
And in the morning, he can't open his eyes.
So have we tried any antibiotic drops?
No.
No, I think that's what we need to do.
Yeah,
So the thing I think that we're probably not passing on to you is that he's got conjunctivitis, it's obvious, isn't it? And it's a bacterial conjunctivitis.
Because this, I cleaned it before we left the house about 10 minutes ago.
I think the thing is, often it clears up on its own over a few days with just wiping it. But if it hasn't, you need antibiotics. How long has it been there for?
5 months, probably.
And we haven't used antibiotics?
Once when he was about 2 weeks old.
Right, OK. So let's try them again.
Yeah,
OK, if it doesn't settle, then come back and see us, OK?
I've just been feeling so frustrated every time I come. I'm just like, my baby's got sore eyes and it's just like, I'm having to open his eyes up for him every time he has a nap.
Oh, bless him. Yep, so 4 times a day. OK, be careful to wash your hands and everything because it is quite infectious. Give it a week, 10 days. If it's not clearing up, come back.
Yeah.
OK?
Oh, thank you. Hugo, sort your eyes out. You'll be able to see again.
OK.
Thank you so much.
No problem. Pizzaurus Rec, eh? That's fantastic. OK.
Thanks.
Bye-bye, sweetheart. He's gorgeous.
Just look up for me. Oh, yeah. Is it itchy?
No.
And this one's OK?
Yeah, that one's fine.
Yeah. And this is the only place that you're bleeding? You don't get any bleeding anywhere else?
No, nothing. Just
no other bruises to see or anything else?
No.
Because it's really common to get nosebleeds. And what I can see up your nose is that there's a little area which is the place that you get nosebleeds from that's got a little bit of a crust over it, and that's where your nose is bleeding from. And mostly, if we give you some cream, that will settle it down, because often what happens is you get a bit of an infection there, and it stops the nose blood vessel from healing up very well, and that's why it keeps bleeding, all right? And it's not a serious medical problem, it's just that you've got nosebleeds. And as long as you're not feeling really dreadful and unwell, then that's all that we need to do. The most important message is to learn how to stop them, because there should never be a kind of nosebleed that you want to, you don't want that to carry on for you.
She panics, and of course she was panicking and made me panic.
And that's part of the problem often.
Yeah.
So you need to learn how to stop them on your own, OK? And the way to stop them is to get your finger and thumb like this. You put your nose right in the middle and grip really tight. Now, often people say grip here. Means no difference, because that's just bone up there and hard cartilage, so you can't do anything there. And sometimes people say, put your head back. Don't do that either, because then the blood all just runs down the back. You need to hold it like this, but really grip tight. And then you need to hold it for 10 full minutes. And then 99% of the time, that will have stopped all the bleeding. And obviously, if it carries on after that, then try it again. But if it doesn't stop after that, then you need to go and see somebody, because then it's really not stopping. But the major problem is that you don't press for long enough.
Press for long enough.
All right? And then if this isn't working, then we'll see you again, just to follow it up. All right? Cheers, then.
Lovely, thank you.
Bye.
Bye.
Firstly, how are you?
Terrible for the last couple of days, to be honest.
Right, what's been happening?
Feel tight around the chest all the time. Slightest exertion, I'm breathless. But I keep going and it sort of diminishes a bit and I can get over it. And then sleeping, lie down, I feel as though I'm suffocating. I sort of get a panic attack, start breathing again, and I found it better last couple of nights, basically sitting up, trying to sleep.
Right. Over what period of time do you think this has happened?
This last bit now is about 3 or 4 days, isn't it?
Yeah, it's over the really hot weather, and his feet are very swollen.
They've never been like that before.
No, so this has happened over the last 3-4 days.
Yeah.
Your ankles have swollen up, but more importantly, you're getting more short of breath when you do something.
Yeah, it might be coincidence. It seems since I've been taking the beta blockers that it sort of pronounced it more, if you like.
But you're getting chest tightness, are you?
Feels like I've been sort of squashed a bit.
And that's for how long?
Only seconds.
And how do you think Alan's been?
Constantly sleeping. If he sits on a flat surface, he's asleep. And he does this regularly.
Okay.
And I can be talking to him like I am you. We're having a conversation, he just closes his eyes. And then wakes up 3 or 4 minutes later, has no recollection of the conversation we've had, which was symptomatic of last time before he had his heart operation. Actually, he used to do that quite regularly.
Still really painful, actually. So it's all up this bone here.
Now I feel pain everywhere. and
Lower down.
In my leg.
OK.
I've sort of landed with a straight leg and it's bent sort of the wrong way.
Arms up.
Ow, there.
It's really limited, isn't
yeah,
it?
it is.
Hi.
Hi.
What's been going on?
I fell down a rabbit hole.
Oh dear, right.
My ankle went up. I heard it crunch and pop and...
Right.
So I've just been getting on with it, but it's not getting better, and it, you know, I can't bend it. You know, like when you sit on your foot,
Yeah.
I can't do any of that.
Okay.
So I think there is some...
And were you able to walk on it at the time?
Oh, well, it was a struggle getting home.
Yeah.
But yeah, I've just sort of like pushed
Just
through
kind of got
it.
on through. And what have you been using for it?
Nothing.
This was which day?
About 7 weeks ago.
7 weeks ago.
Yeah.
So what's brought you up tonight then?
Well, it's just not getting better.
Yeah.
I am going on holiday on Tuesday.
Okay.
So I just wanted to check before I went.
Yeah, because I think, you know, if you did sprain your ankle,
Yeah.
which is what probably has happened, then it does often take months to get better.
Yeah.
Is it sore at all?
Yeah, it's more here.
Not round the back, though.
No.
Move it round and round.
It's there.
This is where it's sore, yeah.
Yeah.
That's where it's painful. Because that's the classic spot where you get a sprained ankle.
Ah, I
Is
can't
it
do
sore
that.
on your foot itself?
No, it's there. And when I bend it...
What about in here?
Yeah. I'm trying not to cry.
But it's more in here rather than in there?
Yeah.
It's more in the over the foot?
It's all of it.
I mean, I think most likely this is just a nasty sprain that you've got. It can put people on crutches, so just because it's a sprain doesn't mean it's not serious.
Yeah.
And it does mean that it can go on for months. It can be worse than a break because actually the ligaments heal up less quickly. Because it's actually more over the foot, though, I think it is reasonable to get an X-ray.
Yeah.
I will arrange that for you to go up and just go and have that.
Drop in.
Yeah. Do you want some painkillers?
I've got painkillers.
You've got some.
Yeah. Is that just any day?
Yeah, 9 till 5, Monday to
9
Friday,
to
so you can
5.
go up tomorrow.
Lovely.
And then why don't you give it a week and then ring just to get the results?
Yes.
All right.
Thank you so much.
Cheers then. Hopefully it will just...
Oh, I
there won't be
hope
anything
so.
there, but if there is, then we'll do something more about it.
Thank you very much.
OK, bye.
Bye.
Do you ever feel as if your heart's jumping beats?
Not really, no.
No. OK, fine. So it'd be good to have a listen to your chest and heart as well, if that's OK.
Yeah.
So we just pop onto the couch here. Nice breath through the open mouth. And out. Let's help you pop that on. Get proper service here, you see, when you come in. There we go. I think what we need to focus on is just this heart rhythm. If you don't mind, it would be good to have another ECG or heart recording now.
Yeah.
And I'm probably just going to have a word with the cardiologist because I'm wondering if we can just sort you out a bit sooner. And also another blood test. Is that all right?
Yeah.
So we're going to take a seat in the waiting room and they'll call you through into the treatment room. All
yeah,
right, but we'll sort you out.
for months and years, don't come here, and then suddenly...
Every 5 minutes. That can happen. That's
Yeah.
all right, we'll get through.
OK.
Come on through. Thank you. Once you've had the recording, if you still take a seat back,
Yeah.
and I'll talk to you at the end, OK?
OK, yeah.
Lee Haskins, please. Have a seat.
Thank you.
Right, what can I do for you?
What it was, I got whiplash down my neck on Saturday.
Yep.
But it's done something to my arm and it's like on numb.
Right.
And I can't lift it to a certain level and it feels really weak. There's nothing there.
What actually happened?
I'm a boxer.
Right.
And I got caught with a shot. I can't remember if it was on maybe my face or something, but it's like whiplash my neck.
Different people have different terms for things, OK?
Yeah, of course.
So what do you understand by whiplash?
I just like put my neck, burn the sensation down my neck.
Right, OK.
I kind of can't twist it.
Can't twist it, OK. Well, how did you feel immediately afterwards?
I felt fine in myself,
Yeah.
just the burning sensation down my neck. I didn't even know there was something wrong with my arm until I got up and then I tried to kind of throw something back and then it was numb.
Have you taken any painkillers for it?
No, to nothing, no.
No, any particular reason?
Just before I went
Just your hard?
Yeah.
OK, fine. And have you had any injuries on your neck? Bad injuries before?
No, nothing before, no.
No, OK. And I can see bruising around there. Is that from the boxing?
From the fight,
Yeah, OK. Was it a good fight? Did you win?
I lost, but it was good. It was a very close fight, but this happened early in the fight, so if it didn't happen, I would have probably won the
Absolutely.
fight. Yeah, so
right, OK.
we're looking at a
Let's have a
rematch.
little look. Right, if you slip your hat off, what I'm going to do is just see your neck movements, if that's all right. So move your head right back. Yeah.
Yep.
Chin onto your chest.
I feel that.
So you feel like, as in pain?
Yeah, a little bit of pain right there.
I've got a 65-year-old chap who's come in with basically symptomatic with chest tightness for the last 3-4 days, which radiates to his jaw and neck area. He's feeling more tired, a bit more breathless when he does anything and when lying flat. And his ECG today, it's clearly keeps varying. It's 154 at the moment. Yeah, he's here in the GP surgery over at Hallfield, so I'll get an ambulance to transfer him over. Yeah, lovely. Thanks very much. Cheers. Bye-bye.
How have things been since we spoke on the phone?
Finally, my headache receded on Saturday.
Good.
But even just moving my head, everything felt totally bruised inside. And this swelling that I've been getting for years now is beyond a joke.
Yeah.
When I got up first thing in that morning, my head was like a football, when normally it swells from here. My whole face, I was so shocked when I looked in the mirror, it wasn't like me at all.
Tell me what things you think have been ruled out with it.
They ruled out, well, they were concerned about meningitis and possibly a hemorrhage, you know, in the head.
But I think the headache has resolved now, so really it's the swelling issue that's the problem that you want to...
I've never had a headache like that in my life,
No.
ever. And I feel very, very unwell. I'm at the
At
end
a
of
loss.
my...
So I confess that I don't know what it's caused by, and we have discussed it a number of times before. And I know that you've discussed it with specialists as well, and in particular the specialists that know you best, which is the rheumatologist, because of both of your rheumatological problems. And so I don't know what would be next, to be honest, and I am aware that sometimes when that's the story, very occasionally I've missed something, and so have all the other doctors, and there is something that can be sorted out, but quite often we just don't know, and we never will know, and...
It's making my life absolutely miserable.
Yes.
On top of fibromyalgia and arthritis and everything, every other condition.
Yeah. Then there's kind of just trying to manage the problem,
But that's
isn't
what
it?
I've been trying to do that for years. I mean, that's why I've come to a point now where I've tried everything I can think of, but I'm nowhere further along the line, except I'm actually worse with it.
Yeah. So the other thing that we have done is you take a water tablet.
Yes,
don't you?
every other day. Yeah.
Do you think on those days you're any better?
I actually think if I had them daily, I probably wouldn't have the problem of constantly going the entire wipe that day out. I think that my body would balance better.
Well, I would be happy for you to try that out as a sort of trial of treatment, really.
Yeah, that's fine.
And
I don't want to stay on it if it doesn't work.
Because my feeling is that apart from moving your drugs around a bit to try and improve the problem, what I would like to be able to do is to try and make things easier for you.
Yes.
And that is, I think, our best option. How does that sound?
Yeah, that sounds sensible. There's one thing I wanted to ask you today.
Yeah.
I've been thinking about this for the last couple of years.
Yeah.
You know, I'm willing to take my medications and do whatever I can to make my life better.
Yeah.
However, I do not want to be resuscitated if anything should happen.
Right.
So could that be put on my notes?
Yes. So
I've spoken to my children about it.
OK. So that's an interesting question. So normally we would have that kind of discussion if somebody had a life-threatening condition or they were very frail, which you don't really have either of those things. So you are neither very frail nor have a life-threatening condition.
I certainly don't look frail, but...
no, I think, you know, you really don't look frail. We have a form that we fill in for that kind of thing.
Yeah.
Where we write down that we've discussed it with you, that you have agreed that's what you want. And then, so what we do is we then use that form and send that off to the ambulance service so that they know not to resuscitate you, otherwise somebody will call and you will be resuscitated.
That's right.
And that form needs to be with you, so it stays in your home.
But it's about quality of life for me.
Yes.
And my life is not a quality life.
No.
It's like being in a prison.
Yeah, well, it's very difficult. The request for DNR, do not resuscitate, was unexpected. There are protocols that we go through to make sure that we're making the right decision, that the patient is able to make the decision, and if not, we would convene a best interest meeting. I think that Julie Dawn's able to make that decision herself. But in this particular case, I decided I would have a think about it myself and also talk to some colleagues. Just going back to the water tablet thing, you only get 28 tablets at a time.
Yes, that's
Shall I
right.
change that so that you can be on them daily?
Yes.
Yeah?
Yeah.
And put that on repeat. All right, well, let's hope that you're right about the water tablets.
Yeah, I hope so. It would be lovely to have a simple answer, wouldn't it?
OK.
Yeah, can but try.
Yes.
All right, thanks very
Okay.
much. Yeah, that'd be
Okay,
fine.
fine.
Thanks ever so much.
That's
Thank
all
you.
right. Bye now.
Bye-bye.
Hello. I've got an appointment at 10:20. I can't remember who it's with.
So it's Dr. McLaren.
That's it. I can't remember the name.
Not a problem. We can always find it. OK, take a seat then.
I got my own, thanks.
How many times do we say that? Habit.
Right, OK. Arms now. If you hold my hands, squeeze them really tight. Really tight, as tight as you can. Hurt me.
Sure.
Yep, absolutely. I'm hard. That's it. Pull me towards you. Pull me really hard. Good. Push me away.
Yeah, that's where I don't feel
That's not working, is it?
No.
No. Right, OK. Just relax. I'm just going to check your reflexes, OK? Right, OK. I'm just going to touch you with my finger, like that, OK? If we roll these back up, if that's all right. So you shut your eyes and say yes each time you feel me touch you.
Yeah. Yep. Yep. Yes. Yep.
So you can't feel there, can
No.
you?
Yeah, no, that's a bit...
So that feels different.
Yeah, this feels a lot different.
So can you show me where it feels different?
Just like down this line.
Yeah. Right. So I think you've done something that's caused a problem with the nerve going into that shoulder, down that arm, and causing the power problem. It's probably in your neck.
Yeah.
I'm a little bit concerned about that.
Is this a fairly recent tattoo? It's on the blue ink, isn't it? That it's lumpy-bumpy. If you feel there, it's not.
I think part of it is infected. It's passing sort of here and here.
Oh, nice, nice matching pair. If I get a proper tattoo, I want a big one.
OK, fine. You can pop your T-shirt back on. So I'll refer you for an urgent MRI, OK?
OK.
If things get worse, please come and see us sooner. So if the power reduces even further, the numbness spreads,
Okay.
The range of movement of your neck, shoulder gets worse, come sooner.
Okay, brilliant.
Is that all right?
Yes, no
But you
problem.
can take painkillers.
Is there eventually at any point I can get like a letter to send to my manager?
Saying what?
Well, because we want to send it to the board that I had problems with my arm, so we maybe
Right.
get a rematch and stuff
Right,
like that.
OK. You'd have to request
Yeah.
a letter, and there would be a charge for it.
Yeah, that'd be fine, yeah.
So you
Whatever.
could do that via reception,
Yeah,
OK?
reception, yeah? Okay, no problem, thank you.
No
Cheers,
problem.
Doc. Appreciate it.
OK, bye-bye.
Do I just get a letter? Do I?
You'll get something in the post,
Yeah, okay, thank you.
All right,
Yep.
bye-bye.
Come on in, come and take a seat. Right, I'm Dr. Ahmed. How can I help today?
For about 3 or 4 weeks now, I've just been getting a flare-up of eczema.
Right.
And it's just not going away.
OK. And have you had eczema since you were a child?
Yeah, and it just flares up when I'm stressed and overtired.
Any reason why you're stressed at the moment?
Yeah, there's a few reasons, but they're things I'm dealing with, so
Okay.
work and stuff.
What work do you do?
I'm a ICU staff nurse.
Ah, OK.
Yeah.
How are they treating you up there?
Oh yeah, it's fine. It's just the
Work
type
pressures.
of work. Yeah, you get some sad cases in and affection more than you realise until you get home.
So do you have sort of strategies in place to switch off from when you come back from work?
I live with 10 people, so I switch off pretty easily when I get home.
There's plenty of people to
Yeah,
talk
there's
to
like- yeah,
and things like
yeah.
that. I think that's the main thing, is to talk about it, because you're
Yeah.
involved with those cases, aren't you? Do you know about Bristol Wellbeing Therapy? It's just an independent...
I've seen it
Yeah.
on our intranet thing.
Yeah, just if you want an independent source of counselling, if you wanted it, there's some information there, and you can do the form online.
Thank you.
And sometimes they just do random workshops that you might be able to attend, and it's just an outlet, really,
yeah.
for the kind of work that you do. You don't smoke, your alcohol sort of intake's fine.
Yeah.
Let's have a look at it.
So it's
just
always
that.
patchy.
Yeah.
So it's there and there. And then
Your face
there.
is all right, isn't it?
It's
Backs of
normally
the
around-
knees? Or?
No, it's I was hoping to give blood next week, but I don't think they're going to let me now, so...
Okay. So I'm going to just do a prescription of hydromol. And at the moment, with the way the eczema is just on the arms, you don't need a strong potent steroid, maybe just middle of the range.
Yeah.
And I'm wondering if on the same prescription, because I know it's difficult for you to get in, if I just put some 1% hydrocortisone,
Yeah,
which is milder, then you can step down.
Yep.
Anything else I can help with?
No, that's great, thank you.
No, fine. OK, so the eczema we'll get on top of, but longer term,
Yeah.
we need you in the NHS for a long, 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 long time.
Yeah.
So I need to look after you. OK.
Thank you very much.
That's all right.
great.
Nice to see you, Bethany.
Have a nice day.
Thanks. Take care. Bye.
Young Zhao?
Yeah. This way, James. Come on.
Hello. That's a very cool hairstyle. Look at that. That's brilliant.
Right.
Right, I'm Lizzie. I'm one of the urgent care clinicians.
Yeah.
How can I help you?
Yeah, the right hand nasal hasn't been feeling well for a couple of months so far.
Couple of months?
Yeah, at the beginning I had the cold, but the cold is after the cold's gone.
Do you want to have a seat?
Yeah, I just it feels like, you know, every time you have a sneeze. But recently, when I lower my head or just knee down, pick up something from the ground, it's a bit sore.
Painful when you lean
Painful.
forward.
Just.
Have you ever had any problems with polyps at all? With any growths inside your nose?
I constantly had blocked nose when I was a little, and then they gave me treatment by putting some patches along my ears, but.
So since a couple of months ago when you had a cold, what is it? Just this sensation that's just never gone away?
No, it's not gone. It's getting a bit worse. It takes longer to get that feeling gone.
Let's have a feel of your sinuses. Do you have any pain when I press around here at all?
No. No.
Any pain here or here at all?
No.
No. And what about over your eyebrows?
No.
No. Okay. Right, let's just have a look up your nose. You're full of energy, aren't you?
Yeah, always. Always.
Just pop your head back for me. That might be a bit big. Right, if you just slide down on the chair and put your head back there, let's have a look up your nostril. Right, I can't see anything obvious in there.
That's good.
I can't see any large polyps, like large growths or anything like that. I think we could try a nasal spray.
That was that was I'm coming for probably.
That was what you were thinking, to try something like that?
Try something like that, just to see whether
If we give that a go and see if that helps.
Yeah.
If it doesn't make any difference at all, ooh, don't go in there.
No.
Just come back around this way.
You see more stitches on that. Yeah.
So, So 1 spray in each nostril twice a day.
Okay.
Try that every day. If the sensation gets any worse or you get any other symptoms, come back sooner.
Lovely, thanks very much.
All right.
Thank you very much for your help. Thank you. Thank you, doctor. Yeah. Let's go.
Bye.
Paul Michelle, please. Paul Michelle. Oh, there you are. Hello. Hi, you come along.
OK.
It says lumps on head on the screen, is that right?
Yes.
OK, tell me about the lumps on your head.
Well, I think I probably have mentioned them in the past.
OK.
But it just seems to me they're getting bigger. And
OK.
3 independent witnesses have told me they're getting bigger.
OK.
I can't tell.
Yeah.
And they're a bit flaky.
Yeah.
They frighten the grandchildren.
Oh, right, OK.
And I suppose I'd like you to wave a magic wand and make them go away, but failing that, some reassurance, I think.
Yeah. What are you worried it might be?
Well, skin cancer.
OK, let's have a look at that. So do you think this is enlarged?
Well, I'm not the best person to ask because I can't see. But, you know, for example, I mean, my dentist that I've been going to for years,
Yeah.
you get back, flat in the dentist chair, and he said, they're getting bigger, you know. And then my barber said, they're getting bigger, you know.
Yeah. But this one isn't in the way of the hair, is it? He says unkindly.
Sorry, this was what?
I said this one's not in the way of any hair.
Well, no, I mean, that's increasingly the case.
I can't speak, can I? This one here, I feel confident is something called a seborrheic wart.
That's caused by a virus, is that?
No, I don't know what causes it, to be honest.
Oh,
It's not caused by a virus. It's the one
Okay.
thing that isn't caused by a virus. I'm not sure what you would call that. It doesn't have any malignant features. Okay.
Right.
So these 2 dramatic things that scare the grandchildren.
Yeah.
Okay. I think they're both benign.
Yeah.
I'm 99% sure they're both benign. I think probably we shouldn't be doing anything with them, but let's get some pictures taken of them and just get their reassurance on that. Is that all right?
Well, as I say, I think reassurance would
And if the
be
dermatologist
something.
is unhappy with them, we'll get someone to take a biopsy or to even to remove them.
Yeah, OK.
The pictures thing gets sent off to the dermatologist. The dermatologist usually responds very quickly once it's been done. So you might wait a bit for the appointment to have the pictures done, but normally within, 3 days, we've got a reply back saying this is what you need to do about it.
Yeah. Well, OK, that's
OK,
fine.
is that all right?
Yeah.
So you could wear a hat, I suppose, not to scare the grandchildren.
Well, I do wear a hat on a sunny day like this. Does you think that makes any difference? I mean, is it it's
I don't think it makes any difference to those, but
advice anyway.
it's good advice generally, isn't it, when you haven't got much hair up top. So if you go and book that with Kay in the treatment room, let's give it a week after you've had the pictures taken and then phone me and discuss what they've said about it.
OK, yeah, that's fine.
OK?
Yes, thank you.
Super. Cheers then. Bye then.
Hi, how are you doing?
Yeah, I'm all right.
Good.
So it was just because thinking might try for another baby some point in a few months later in the year, and wanting to come off the sertraline and just kind of make a plan for that. So.
Yeah, OK. How's everything been going from that side of things?
Yeah, good. I mean, I think I'm just a bit of an anxious person, but yeah.
Well, that's all right, but actually things have been quite calm and settled in the last little while?
Well, we both changed job and moved house.
Right, so with
in January and
all
February,
things considered,
but
because that's a stressful time, isn't it, if you do all of that
Yeah,
stuff?
but we've just had a holiday. And,
Yeah. I mean, you're looking very well for it, you know. So
thank
that's
you.
good. And you're thinking about another baby, so that's exciting.
Yeah, not immediately.
Have you done any reading about sertraline and the risks of being pregnant with it? Or?
No, I just presumed I would come off it.
Yeah, I mean, generally that's the right thing to do. There are some risks of, rare risks of the baby not forming properly if you conceive on sertraline, although that's a rare thing. And of course, if people are so ill that with the mental illnesses, you know, anxiety or depression, that they need the pills, then the risk would be greater to stop them rather than to conceive on and off them. So it's a bit of a balance, is I suppose what I'm saying. And I think for you, if everything's going really well, then this is an ideal opportunity for us to think about cutting it down, because actually, anyway, if you're going to have a baby or not, we should be cutting it if you don't need it, isn't it? So, do you think that you're going to be all right on cutting down? Do you have any worries about that?
No, I think a bit of a wait and see.
Yeah.
The only thing is I've missed a couple of days here and there, and I felt a bit off, queasy, like more physically.
Okay,
but then I figure we'll do it slowly.
Sure, and I think that would be the main thing to say about coming off it, is that people do really notice when they come off them. And that's fine. It's common and normal to get some side effects as you reduce, but it just means that we need to do it really slowly.
Yes.
And so sort of over 4 weeks as a minimum, and sometimes even stretch it out even longer. And what you can do is either just miss out a dose and then take one the next day, or you can just take half a tablet as a way of reducing. Does that sound okay?
Yeah,
do you need any more today?
I've got
to get you through
box, I think.
Okay.
So.
Because that one box is a month, and so actually that will give you plenty of tablets then to be able to do that.
Yeah.
Does that sound like a reasonable step?
That's absolutely fine.
I probably don't need to see you again unless there's any problems.
No, I'll make an appointment if I need to.
Great.
Yeah,
I think that's the thing.
fine.
Or if it gets really bad, just give me a ring.
Yeah.
Or just go back to the dose that you were feeling fine on, because actually then you can just cut it down even more slowly.
Okay.
All right?
Thank you.
Good luck. Fingers crossed. And
Thanks.
I look forward to seeing you as and when.
Take care.
Bye then. Nice to see you.
Come on in, have a seat. I'm Dr. Graham.
I've got an existing injury. I had a spinal injury in 2008. And I have a weak arm.
Yeah.
But today, all day, I've had really bad pins and needles, and I felt really tight and uncomfortable, and it's just making me feel really anxious with it, which is probably not helping.
Yeah. What was the injury that you had?
C5-6.
Right.
So I've had an operation. I've had nuts and bolts in there. So now and again, I will wake up with pins and needles, and when I'm working it too hard, I get pins and needles.
Right.
But it's been constant today, and it's been really nagging.
Yeah.
And it just doesn't feel right.
Yeah. And what do you think might be going on?
Part of me thinks maybe a trapped nerve or something. Yeah. I've been feeling it in my leg a bit.
Right.
I'm not in screaming agony.
Yeah.
It's all numbness. I was struggling to hold a pen. You know, I could hold it, but not for long.
Yeah. And when you had the surgery before, had you had an accident that caused that, or was it?
I fell onto my head.
Right.
So I crushed the nerve, and it crushed between the discs. So the discs have come out. I was paralysed neck down.
How are you, Mrs. Smith?
OK, thanks. Not too bad.
Good. It's nice to see you smiling.
Shall I take my coat off, you don't mind?
Yes, no, that's not a problem. Do you want to pop it behind the chair? Is that OK? Or you can hang it up on the other...
John.
You're not wearing your designer coat then today? Don't care about that one. OK. You gave me a book last time.
Yes.
On meditation and mindfulness. And I'm symbolically giving that back to you.
You were very gentle.
That implies that if you've experienced differently before... Your blood pressure's been quite steady.
And I've got no worries, my darling, thanks to you.
Well, it's a bit up this morning, actually. Blood pressure. Carl Hazard, please. What's on your mind this morning?
Right, I've got a history of osteomyelitis in my right ankle. A couple of days ago, I had a bit of a temperature and quite a bad headache. And I woke up this morning and I've got real bad pain on the inside of my right leg and sort of from the groin to the knee.
OK. You've got a history of spina bifida, and you've got this problem with the right foot.
Yep.
So there's a combination of orthopedics and plastic surgery.
Yep.
Spina bifida is a condition that occurs in utero, in other words, when you're pregnant. It's a problem with the development of the spinal cord and its coverings. It can result in problems with muscle weakness as well as fluid around the brain.
This is quite sore down here as well, where I've got the muscle graft.
OK. And I'm going to just pop you behind the curtain here.
Yep.
I just want to have a listen to your chest and have a look at the leg. So, is it all right to call you Carl?
Yeah, of course it is.
She says, having called you Carl all morning. Oh, there we go. All right. Carl has a significant past history of osteomyelitis. This is a very serious condition whereby you can get an infection in the bone. We also have to bear in mind that Carl has metalwork in his leg, and this is a foreign body. If that gets infected, it can be threatening to the limb in the sense that he could lose that limb. OK, and there's pain in the groin, isn't there?
Yeah.
Does it hurt when I touch?
Yes.
OK, can you push up against my hands? Good, and on this side. Good. OK, I'll let you get dressed. Take your time.
OK.
Is it stopping you from doing anything?
Not really stopping me doing anything. It's just when I walk, it's just gets a bit painful.
There's no signs of any infection.
OK.
I think it would be a good idea to run a blood test this morning because we'll get the result fairly quickly. It may be worth just reviewing you back next week.
OK.
And sooner if things haven't settled or if they're getting worse.
Yeah, all right.
Because of your past history, we're just extra cautious.
Yeah.
But often these things turn out to be just a muscular something or another in view of your
Hopefully
general
it will be.
orthopaedic history, you know? Things, but we'll check you over.
OK. Thank you
All
very
right,
much.
that's not a problem. Take care.
OK, all right. Thank you very much.
Bye-bye.
Thank you. Bye-bye.
You got to laugh.
Well, you would, being a City fan.
All right, so I think you might be right that the disc may have come out again to a very much smaller degree, and it's pressing on some nerves.
Right.
OK? So you probably know this, but you know you've got your bones in your neck.
Yeah.
All the way down your spine, and in between you've got glue-like stuff, which is called disc, and your nerves come out.
Yeah.
And a little bit of that has come out and is pressing on the nerve, and it's sending the wrong messages down, so the kind of numbness messages, but also pain. Normally, it goes back in again on its own. Do you see what I mean? Okay. But this time, it's staying out for a bit longer than you're used to.
Right.
Does that make sense?
Yeah.
The question is what we do next, OK? Yeah. So the first thing is to think about some pain relief. And the second thing is to think about whether we want to just give it a few days and see if it just gets better on its own, OK? And if it doesn't, then we'll probably do another head scan to see what's happening.
Would that be like an MRI?
Yes. But I'm not saying you need that yet. You know, we know...
I'm reassured that it's something connected with what I've already...
I think it's most likely to be exactly the same as what you had before. Obviously not the whole neck down, OK?
Yeah.
No, painkiller-wise...
I'm not in a massive amount of pain.
OK. So the kinds of things that would worry me and make me think we need to see you sooner would be if you were to get any problems with your bowels or your bladder, you know, losing control of either of them, you know, because that is a worry because it's affecting the nerves that control your bowel and bladder, and that is an emergency, really.
OK.
OK?
Thank you for the reassurance.
OK, good.
Much appreciated.
That's
Lovely.
all right.
Thank you. I'll go and carry on.
OK, bye now.
Cheers, bye-bye.
Camera. Okay, Hyland. Right, let's just bring up a chair. Do you want to sit in that one and Mummy can sit in that one?
Because this is for you, not me.
This is for you. This is something to do with his ears, I gather. Is that right? Yeah.
Yeah.
Just fill me in.
He had a perforated eardrum.
This is when he saw Lizzie Harris recently.
Yes,
yeah?
yes.
And how's he been since then?
Good, really good. We just want to make sure, because he's not been swimming for a while and he normally does that on Tuesday.
The ear was discharging, is that right? Yep. Has it stopped discharging now? How's his hearing, do you think?
Good. Back to normal, I think.
Is it?
Yeah.
OK, well, that all sounds good. All right. OK, let's have a look. So it was the right ear that was the bad one, wasn't it? And the left ear, as you said, was normal? Yeah, OK. Can I look in your left ear first? Can I look at that one, your good one first? Look at that. OK. All right, so that is a normal ear canal, normal ear drum, no holes or anything. We wouldn't expect it. If I press there, does it hurt?
No.
If I press there, does it hurt?
No.
Good. Very sure about that. OK, I'm just going to take slightly longer over this one. No, everything looks intact, actually. The eardrum is marvellous at healing itself in the majority of cases. So it looks normal, OK? There's definitely no hole in that.
Oh, wow.
A nice sort of shiny eardrum and no inflammation or anything. So, yeah, you can go back to swimming.
Yay.
Yeah. And I'm surprised you say that his hearing's completely back to normal, because it often takes a little bit longer than this, but if it is, it is. So that's great. So, yeah, no restrictions, really.
Lovely.
OK. All right. That was quick, wasn't it?
Yeah.
Good. OK.
Thank you.
Cheerio, then.
Thank you.
All right, well done holding the door open for Mum. It's like a trap, isn't it? It's like an assault course. OK, cheerio then. Bye-bye. Bye, Cameron.
All done.
Bye-bye now.
Bye. Bye-bye, boys. Say bye.
Health Centre, Sally speaking.
What would happen if those feelings got worse? What would you do?
Before, especially first year of uni, I drank a lot. For like 3 bottles of wine within the space of 10 minutes.
Have you had sex yet?
If he wants to have sex 6 weeks after giving birth.
Now, I'm going to need you to lie on your side. So next thing you feel will be a slight prick as we put the needle in, OK?
Have you got any illnesses that we should know about that you've had before? Are you on any medications?
I was shot a lot of times.
I'm unhappy to mention it is affecting my sex life.
So what the bruising is?
Yeah, it's actually spread across into my genitals, basically.
Oh, goodness me.
We're working on a morning surgery, so if it's urgent for today, it is going to be end of surgery at 11:30.
Sarah, jeans, please.
I've got this,
All right.
on my leg.
Yeah.
Now, this is the 3rd or 4th time it's come up. I've had steroid cream.
Uh-huh.
I've had penicillin antibiotics.
Yeah.
It started off as a bite or a sting on that spot there.
Right. When was that?
8 weeks ago.
Was it?
And it's coming up again. I finished the antibiotics last Thursday.
Yeah.
So it's a week, and it was fine, and now it's starting to flare again.
Just have a seat. I'm going to come and have a closer peer. So when you use the antibiotics, what happened?
It seemed to get better.
Right.
And then but like I say, it's flaring up again.
So when you use the antibiotics, it makes everything better?
Well, it
Or
did
does it
do.
not?
Yeah, no, it did, yeah.
Yeah. How many courses of antibiotics?
First of all, I put bite and sting cream on
Yeah.
it. Then I had steroid cream from the doctors, and then a course of antibiotics.
OK. Do you get psoriasis at all?
No. I've never had psoriasis, although my mother is riddled with it.
Right, OK.
Hello.
Just returning that key.
Wonderful. If I could ask you to put that straight on one of the top first 4 hooks, that would be very gratefully received. Thank you very much indeed. Pleasure doing business with you.
Come on in, have a seat.
All right, thank you.
I'm Dr. Graham.
Hi.
We haven't met before.
No.
You're a new patient here?
Yes.
Yes, you've moved from a local practice?
Northville.
Yeah. So what do you think are your main medical issues at the moment?
My breathing.
Yeah, sounds like it, doesn't it?
Struggling in the last few days.
Right, so you've got COPD.
Yeah.
Yep. And any other, you've got diabetes.
Well, they think I have, but they think it might be to do with, because I'm on so many steroids.
Right, OK, well, we'll talk about that in a minute. And then, so you have, obviously, home oxygen.
Yeah.
You've got a high cholesterol, high blood pressure. You've had heart disease.
Yeah.
The steroids, what do you think you're on the steroids for?
That is for...
polymyalgia rheumatica.
I can't never say it.
You've got your cholesterol tablets, atorvastatin, yeah?
Yeah.
Candesartan for blood pressure. Then you've got the bone-protecting calcium vitamin D tablet. Lansoprazole for your stomach. Nebivolol, which is for your heart.
Yeah.
Sertraline, antidepressant, and spironolactone, which is sort of a water tablet. In your last practice, they decided that you do have diabetes.
Right, OK.
OK? Have you seen a practice nurse ever for a diabetes check?
I think I've got an appointment with one to see about it.
OK.
On the 8th.
Brilliant, yeah, you're seeing Mike.
Right,
and he's
okay.
actually going to do a check of your heart disease, your diabetes, and your COPD.
Shall I bring Pat lunch? OK.
Bring a packed lunch, yeah, not a bad idea. So the bottom line is you've got a lot going on, haven't you? But it sounds like, to be honest, you're fairly on top of it. You kind of have quite a good understanding, I think, of what's going on.
Yes, I do understand.
Really, your heart scan suggests that you've got a little bit of heart failure, that your heart, normally it pumps like this, but it's sort of pumping like that. And that's why you need a bit of help with your fluid, OK? So I'm your doctor.
Yeah.
And we have a system here where we try and get you to see your own doctor as much as possible. If it's a query, then you can book a telephone appointment and I'll call you back. I think we just need to get you to know you a bit.
OK, then, thank you.
Good.
Right.
Great. Nice to meet you.
Yes. Probably see you again.
Yes, I'm sure. OK,
All
bye
right,
now.
Thank you.
Sometimes with psoriasis, if you are prone to it, and sometimes it occurs in a place where you've got an injury, a trauma.
OK.
And of course, the bite and the infection may be enough to cause a patch of psoriasis. Sometimes bacterial infections with the commonest thing that causes skin infections called Staphylococcus. So have you heard of those bugs? Well, they cause skin infections really commonly.
Okay.
They can sometimes cause blistering. So it's a little bit of a mystery. I think what I'm going to suggest that we do is the antibiotics seem to work. I'm going to give you a higher dose and a longer course for 2 weeks and then see what happens. But if it's not settling down, we'll see you again. And if it all goes away, then job's done.
Okay.
All right.
Thanks
Nice
very
to
much
see
for your
you.
help today.
Yeah, no
Thank
problem.
you.
Nice to see you.
Thank
Bye.
you. Bye.
OK, that's fine if you'd like to go to the upstairs waiting room.
OK, no problem.
Thank you. Hello, can I help?
Mr. Apatrasoe.
Yep.
I'm Dr. Lee. Come on down.
Expect to be from China.
Yes.
Or Jet Li or Bruce Lee.
Yes, come and have a seat. People often expect a Chinese doctor with me.
Doesn't matter.
No, have a seat here anyway. I think you're a visitor. Are you visiting us? Or are you a patient here?
For the moment, I need to subscribe, because I need the doctor.
You're up in Brown, and that means you're what we call a temporary resident, I think. But you're living here, are you? Are you going to register permanently here?
I have, yeah.
Where have you come from?
My father from Belarus, my mother from Greece,
Okay.
from Athena.
Yeah.
And I'm Danish resident. After the high school, I was a security officer from army, SWAT, you know, the special squad.
Yes.
You know, paratroops and other things.
Have you got any illnesses that we should know about that you've had before? Are you on any medication?
I was shot a lot of times.
What's brought you here today?
Throat, headache. That's the only reason why I called up, is because I had this sort of quite bad headache this morning.
And how long has he been complaining of headaches for?
Since he started a nasal spray.
And it's all the way from here?
From here.
Down to?
Here.
Down to the back there?
Yeah. Sometimes it's right on the center.
It's in the middle, yeah.
Inside, really, you feel sort of heat.
I was shot a lot of times.
Do you want to tell me a bit about it?
I was cut here. This is from 1986. This is from 92. I have another one here. I was shot here. And 48 part of metal was here.
Oh, yeah.
And take it out. But I'm perfect, no problem with this.
Okay.
The only thing what put me down, it's sinus. I have pain. It's sinus. Yeah. No. I don't feel good.
No. And you're not taking any tablets or medicine?
Today I don't take it nothing.
No, right. So is it here? Just right there.
Yep.
And then if I just take those off. So here's your other sinus. That's your frontal sinus there.
I know it's facial sinus.
Yeah.
I know about this. This you have a lot of sinus.
Yeah, and
but
these
here it's about this one.
And these ones
not
are all
this.
right, are they?
Yeah. Malar sinus, it's okay.
Okay. Is there anything coming down your nose from up here?
Yeah, was yesterday some like yellow things, and in the morning blood.
Okay. A bloody discharge is very characteristic.
It's good if you.
I'm just going to do your blood.
Go out.
Yeah, but it does make it very likely that your sinus is infected. So you have diagnosed yourself correctly, I'm sure. Okay. Relax a little, and I'll just see what this is going to be up to. It's 184 over 104.
Because of pain.
Do you think? Okay.
I'm pretty sure about this. Okay. Because normally I have 137.
But I'll print you out an antibiotic to take for this. Are you allergic to any antibiotics?
No. I'm allergic for the stupidity. The only thing.
Take this, 2 today,
yeah,
and then 1 every day till you've used them up for a week. That should settle it down. You must now book an appointment for maybe 2 or 3 weeks' time to come and have your blood pressure checked again.
Okay.
And I hope you're better soon. Yeah.
Thank you very much.
Thank you. I hope
welcome
to see you in 3 weeks.
Come on in. Have a seat.
Thank you. Yeah, I was in hospital all of last week.
Oh dear.
Because of the DVT thing. It bled everywhere.
Bled?
I think it was a varicose vein on the surface of that.
Yeah.
I was washing up and it just bled everywhere.
So it was the bleeding that kept you in hospital?
It was the bleeding that kept me in hospital and the swelling of my leg, and they said that the DVTs got bigger.
Have you got an appointment with the haematology doctors, the blood doctors?
Yeah, I'm getting one. Okay. I'm literally waiting to hear.
Is there anything to see, or is it all covered up with
It's
the
all
big
covered
dressing?
up.
Let me not look now, because actually, as long as it's OK from your point of view, the nurses are going to look this afternoon. So if there's anything if I take the dressing down and it causes loads of bleeding, then we'll have to get the nurses involved.
Also, as well, I haven't been on them for a while, but I was on citalopram. I feel kind of OK, but I'm kind of waiting to go down.
And was it depression that you suffered with before, or did you get much anxiety with it as well?
Yeah, the anxiety's kind of gone.
And when people get depressed sometimes, they get, other thoughts or other...
Yeah, I have been there.
More serious kinds of thoughts.
Yeah.
Has that drifted in, do you think?
Yeah, a little bit.
Hello, can I help, sir? All right, can I help?
That's exactly why I'm here, hearing problem. You going on?
I know, absolutely.
Catherine Amesbury, please.
Oh, that's me. OK.
Hi. Come and have a seat.
Nice to meet you.
Right, OK, so we spoke on the phone beginning of June, didn't we, about your X-ray? Yes, OK. And how is your back?
Bad.
Right.
I've got a trapped nerve now. It's just constant pain. So
OK.
I don't know. What did the X-ray show?
Well, it shows some wear and tear, but it also shows reduction of the disc height on a couple of levels, so it makes me a little concerned. Is there any thinning of the bones?
Well, I've got sciatica at the moment all the way down this leg, and my leg's actually not working properly.
Right, OK.
It's really strange. It's like it doesn't belong to me.
OK, can we have a little look?
Yeah.
Pop yourself up on the bed. OK. And if you bend this, so try and pull your heel into your bottom, OK, and push it up to the ceiling. Good, OK. Against again. That's it, right?
That's the weak one. Can you see what's wobbling?
I'll just check your reflexes. Yep. Good. Fantastic. OK, you can jump up for me. OK.
I had a riding injury
in
my very early 20s, and I displaced 2 vertebrae, and it never was quite the same after that.
Sure.
But regular osteopathy. I mean, I can go for 2 or 3 years without seeing her, and then I'll tweak it, and she'll get it right. But this time, I haven't known how to get it right. So, yeah, I'm just frustrated because I can't live my life the way I normally live it.
Yeah.
My maternal grandmother had osteoporosis. She was bent double in her 70s.
Right.
But I have been on prescriptive calcium, vitamin D since my 40s because there was a risk.
So this graph shows us the green is essentially you don't need to do anything, OK? The yellow is we need to measure your bone density via a DEXA scan, and red we need to just treat. Now, you are very much on the border.
I'd like to know then if I
Yeah,
can.
I agree. In terms of your pain and management at the moment, are you happy with what you're doing?
Yeah, I don't want any.
No. So we'll wait and see what DEXA shows. If you want some physio, just let me know.
Thank
All
you.
right, no problem.
Lovely
Well, nice to meet you. Yeah, you
Thank
too.
you ever so much.
OK.
Let me just check. You haven't had any more suicidal...
Not since being at home.
Plans or hopes to die or anything getting so serious that it's got that bad? No.
Not since coming out of hospital.
What would happen if those feelings got worse? What would you do?
Normally, I lock myself away for 24 hours. In the past, what I've done, completely just lock myself away, don't do anything, don't allow myself to eat, don't allow myself to go to the toilet, nothing. And then I normally come out of it. Before, especially first year of uni, I drank a lot.
That's a common reaction or way of dealing with it.
And a lot quickly. So like 3 bottles of wine within the space of 10 minutes, like a lot.
Gosh, that is a lot. Mental health problems are really common, and young men suffering with depression is one of the things that we see very commonly in the surgery. William has suffered with on-off recurrent depression over the years, for which we've been supporting him. The natural feelings that you have when people first tell you about something really deep and personal is to empathise and do your best to be compassionate with them. And then the next stage is to try and move on and come up with some solutions to help them move forward with that problem. So it sounds... I mean, this is obviously complicated, isn't it? What about any counselling? Are you having anything at the moment? I'm just going to look at see if I've got any past history here.
Because I know I was on 10 milligrams and they increased it to 20.
How long have you been on it for?
Oh, God. It was when I was in 6th form, so when I was 17.
Yeah. So you've been on and off it for your mood for 6, 8 years?
Yeah.
It does take between 2 and 6 weeks to have its full effect. And starting off slow and building up is a sensible thing, because then there's less to come off later. Do you want me to organise some counselling for you or give you the details about that? Because that's one of the other mainstays of treatment.
Yeah, that'd be cool.
And as I say, if anything changes or gets worse in the meantime, just let us know more urgently, obviously.
Oh, I do. Awesome. Thank you very
nice
much.
to see you. Bye, then.
Bye-bye.
Hello, reception.
Hello, I need to make 3 appointments.
Hello, come on in.
Suffering terrible with migraines. Been suffering for about 6 years. I did get a preventative topiramate.
Okay.
It worked, but it stopped working now, so I've just given up taking it. I just thought it's best to come in and see you.
Yeah, have a chat about it. How often are you getting them at the moment?
I can get 5 a week sometimes.
Describe them for me, just
So I go funny in the eyes, and the head feels like it's and it's all pain in the neck as well. Just like a pressure building up, and then you feel like you're sort of slurry talking and things. So it's just strange how they just come on all of a sudden. The Imigram tablets are really great when you get an attack, but they do make you feel a bit... But they're brilliant for when they are needed.
So they're quite effective.
Yeah, amazing.
Yeah.
I just wondered if there was any other type.
Preventative, yeah. The answer to your question is yes, there are other things we can try. There are actually quite a few different preventative treatments for migraines.
Okay.
So we often try beta blockers, which were originally designed as blood pressure medication.
Okay.
But we use them for migraine treatment. They very occasionally drop people's blood pressure a little bit and that can make you feel a little bit dizzy the first time you take it while your body's adjusting to it. So we'd often try one that's twice a day.
Oh, twice a day.
Initially, I'll give you a month's worth as a kind of trial.
Okay.
If you find that it's not really the answer, give me a ring or come and see me again.
Yeah, it's easier to find sometimes, isn't it? Thank you very much for your help.
Great to meet
nice
you.
to meet you as well.
Hello, can I help?
Hi there, it's Dan from Speechwrite. I've got an 11 o'clock with Guy.
With?
Guy. Guy.
Glyn.
Glyn, is it? Oh, they put
Oh.
Guy. Sorry, Glyn.
Leave me. The scarf, though.
Just get a phone, come back in.
I'll probably be still sat here.
Probably.
Okay.
If you're not.
Sean Priest, please.
Oh, here we go. That's me. Brilliant. Hey, can you guess what it is yet?
Oh, mate.
Oh, yeah, definitely, yeah.
Right, I'm Lizzie.
Hi.
What's been happening?
So, Tuesday of last week, I had a motorbike accident, collision with another vehicle. Fortunately,
Car?
yeah, well, Volvo, so, you know, might as well have been a tank. Yeah. So I was thrown clear of it, landed on the verge, but I took all the impact on my hip. I managed to sort of bounce off the side of it and do a bit of a Superman impression.
Through the air.
Into the verge on the other side of the road. Basically, I can't sleep. That's one of the main issues because of the pain. Also, I've got some concerns. The blood from the bruise is beginning to spread. It spread around my sort of lower back, down my leg. It spread across my groin and into other areas.
Right.
Yeah.
Okay.
Yeah, so that's kind of a bit interesting there. So.
Okay, can we have a look?
Yeah.
All right.
Sure.
See how bad it is.
Yep, no problems. I'm unhappy to mention it is affecting my sex life, as if having a smashed up hip alone wouldn't.
So what the bruising is?
Yeah, it's actually spread across into my genitals, basically.
So, oh, goodness me. How are you, Michael?
Struggling, really
Yeah.
difficult.
I understand you had a fall a few weeks back, was it?
Tuesday. I'm always falling over my hips.
I don't remember bumping it. And I span, and I fell on my right side.
As I've like jumped and sort of came down and landed on my leg, it's gone backwards quite a lot.
I tripped and then I landed sideways on.
Sleeping is just, you know, forget about it.
When you say it's affecting your sex life,
It spread into my testicles and pretty much halfway up.
meaning that it's painful or you can't get an erection? Or...
No, I'm functional, but it's tender, very tender, yeah. So, yeah, if I could figure out how to manage that, that would be nice. Or just an idea of how long this is going to go on for.
Right, so, OK, pull your pants up.
Yep.
Come and have a seat again. So, the amount of bruising that you've got,
Yeah.
I'm not surprised at. I wouldn't be overly concerned about it. Given the mechanism of injury, if we've come away that lightly, it's probably only down to the fact that you're quite muscly and you've got muscle to protect all of your bones and everything.
And muscle that bruises easily.
Yeah. You've obviously caused so much damage underneath
your skin on the hip here.
Yeah.
It's filled to a capacity and then it's not really had anywhere else to go, so it has spread round the other sides a little bit.
Yeah.
Have you noticed it carrying on, spreading further? Or
It's reached the back of my leg just today. It was about here before, but this morning it's all down there. It seems every time I wake up, you know, it's in new and exciting areas.
If at any point it looks like your circulation is changing at all, you know, if this lower leg starts going a bit of a funny colour, if you start to lose some of the sensation or anything like that, need to see you straight away and probably send you up to the hospital. In terms of what you can do to try and reduce it, the only thing that you can really try is just to ice it.
Is there anything I can do for the sort of pain management side of it and sleep?
Paracetamol, 2 tablets, 3 times a day during the day, and then your 2 cocodamol at night.
Okay. Are there any kind of like maybe almost like home remedies I can use to sort of try and disperse some of this blood, or?
Just gentle. You could try a gentle massage.
I'm talking about one specific area.
Not like deep tissue. Oh right, okay.
Yeah, it's not pleasant, and it's
There really isn't very much that you can do.
Okay, I'm happy to try deep tissue massage on the area. But,
I was thinking of your leg.
Brilliant.
I would just give it a rest if I was you.
Yeah.
Just give the whole area, just give it a rest.
Right, okay.
If it's hurting, it's trying to tell you, you know, give it up. Just stop for a bit.
Okay. Put it on the back burner.
Yeah.
Brilliant.
Abigail Lee. If you can walk like that.
I can walk and feed.
Well, I'm Dr. Lee, so that's very good.
Yeah.
We share a name.
Appropriate, isn't it?
Hooray. So, is this a girl or a boy?
A boy.
Oh, very nice. And is it your first or not? How? So today, starting with you, how was it?
What, the birth?
Yes.
It went as well as such a thing does.
Yes.
Basically.
It's quite an experience, isn't it?
Yeah, and we had a home water birth. And that went really, really well.
Ooh,
I mean,
did you?
Yeah.
For a first baby, that's very good.
Yeah, it went. Yeah, it was. Well, you know, I won't say it was good exactly, but it went well. I didn't use anything, and yeah.
Well, it's very unusual to actually manage your first at home.
Yeah.
Did you tear or have stitches?
I did tear and I did have stitches. Yeah, I had a 2nd-degree tear.
How is it? Has that healed up quite well or not?
Yeah, I think so. I mean, I don't feel anything anymore, I guess. I'm not sure when it sort of... Oh, thanks for that. I'm not sure when it stopped hurting, really. It did hurt for a lot longer than I expected it to, I have to say.
So would you like me to have a look? Or
I think
if
I'm
it
all right,
feels
to be
fine
honest.
to you, it's never quite the same as
Yeah.
it used to be. But as long as it's not too tight, really, that's the thing. Occasionally people get sewn up and they're just a bit wonky or tight. And that often settles down. And
That's all right.
sex, have you had sex yet?
Who wants to have sex 6 weeks after giving birth?
Hello, morning. Come on through.
Hand over your mouth when you're coughing.
Come on in. Come
Hello.
Take a seat. Hello.
You all right?
Yes, not too bad, thank you. So, Riley, you're nearly 11.
Yeah.
You've got this terrible cough.
Yeah, it's been about 3 weeks. Basically said it's starting to hurt his chest a lot, but I don't know whether it's just because he's coughing so much, but it's getting deeper and deeper, so...
So it's been there for 3 weeks already, and it sounds like this day and night?
Yeah, it gets worse at night, definitely. It's constant.
OK. Any temperatures or anything like that?
A bit hot now and again, but nothing major. It's just...
And are you bringing up some rubbish when you cough?
Yeah.
Mm. Do you want to put your top things off for me? And is Riley up to date with all vaccines for his age? Looks like he is.
Yeah, he doesn't really go to doctors very often, as you can see. He's very limited.
Yeah.
It's probably been about 10 times in his life.
Let's have a look in your throat. Open wide for me.
Turn out. Ooh,
Okay,
where are you going, Bert? It's okay. Who's that? Peppa
Let's have a listen to your chest. If you come up here for me. Yes, please. Pop your T-shirt off.
Fred?
Excuse me.
Where's he going?
Come and take a seat there, OK?
Is there?
Yes, that's fine. Deep breaths with the open mouth. OK.
Where are they going?
That's fine. I'm just going to have a feel if there's any glands around, OK? That's fine. You can pop your things on. Come and take a seat.
How are we sounding then, Doc?
Well, I mean, the chest actually doesn't sound too bad.
OK.
So the cough sounds worse than the findings. So there's no temperature, you know, everything else is sounding OK. I'm a little bit suspicious of whooping cough. Pertussis is the other name. You know, it's just tends to go on for a bit, and it's sort of, once you start coughing, you go on and on and on and on, and then stop, and then it keeps going on like this day and night. So I'm wondering whether we should do a swab, actually, for looking for pertussis. Whooping cough is a very severe spasmodic cough, by which I mean you get bouts of severe coughing, and according to the textbooks, a characteristic whoop sound at the end. However, in real life, you don't always get that. It usually goes on for 2-3 weeks, and patients present very tired with their symptoms, often not sleeping due to their symptoms. If you wanted to look it up, you can on patient.co.uk.
No problem.
Website. OK.
Quick nose swab out there, is it?
That's just... If you take a seat in the waiting room, and we'll get that organised straight off. There's a key and a phone.
That would be me, yeah. Thanks. Come on then, Fatty.
Sweetie?
Hello.
Billy, come here, please.
Hello. No, they can do with all the help. They need all the help they can get. He's just looking at flowers. It's fine.
Yeah. And did you have any other problems in the pregnancy that I should know about?
My left outer thigh went numb, went about 20 weeks, and it's still numb now. And I assumed after I gave birth, I thought, oh, it will just go away, but it hasn't.
Which bit of... It's on the outer border there?
Starts about here, goes down to about here.
Are you all right?
Yeah, of course.
Take him over here. You can just lie him on you.
Do you think you could hold him just for a sec? So I leak really badly, and I've got these breast shells. It's a bit embarrassing, and I frequently do that as well.
Well, I'm having to practice because my first grandchild's coming soon. So
oh wow! Congratulations!
I know. So this is kind of fabulous.
Just up here,
like that, and then if you take him.
Yeah. Hello, little one.
Ooh. OK, that's great. So here's a bit of cotton wool, and I'm just touching your other leg with that. Can you feel that?
Yeah. Yeah. Yeah.
And how does it feel? Is it?
It's really hard to describe because it isn't.
It's less.
Yeah, it's just less. That's the only way I can think to describe it.
Now, I'm not going to hurt you with this, but I'm just going to... It's a pinprick.
Yeah. Yeah. It's very, very slight, though.
The good thing is the sensation is actually there.
Yeah.
Can get that back up. I'll come and help you in a sec.
Thanks.
So the sensation is there. That nerve has obviously been probably bruised at some stage. I think it's a matter of waiting. The nerve is working because you can feel pinprick, you can feel different kind of sensations there. And although it's a bit dull, it will slowly come back. Sit tight, it will almost certainly just slowly recover.
Hi, I've run out of my pills, but I don't know if I need to make an appointment with the nurse or can I just get a prescription?
Contraception?
Yeah.
A nurse appointment every time you need a prescription.
Oh, is it now? Oh, I thought it was every, 6 months or something.
Hello there.
All right.
Come along. So I think Dr. Pitt arranged for you to come and see me, is that right?
Yeah.
And prior to that, you'd seen a physiotherapist who thought that it might be useful for you to have an injection. And they've written in the note that they think you've got something called trochanteric bursitis, which is a inflammation in the layers over the hip joint. Which side is that?
On the left.
Left side, yeah. Can you show me where the pain is?
I'll stand up and show you.
Yeah.
There.
Yeah, let me just have a feel down here. If I hit a sore spot,
yes,
that's it there, is it?
Yes.
Oh, sorry. OK. Well, that is over what we call the greater trochanter, so that would fit with this. So what Dr. Pitt suggested was that maybe we put a steroid injection into that spot. So you're happy to go ahead with that on that proviso? OK.
Give me back my legs.
Sorry?
Give me back my legs.
Well, don't have too high a hope, really. My hope with this is that we will relieve the tenderness at that sore spot.
It's worth a try.
It's worth a try. So I'll need you to get up on the couch. What we've got here is some steroid with local anaesthetic in with it. Any problems after this injection, particularly if you feel that it's inflamed or you've got a fever, do get back in touch with us. Okay. Now, I'm going to need you to lie on your side. I'm just going to mark the point. So next thing you feel will be a slight prick as we put the needle in, OK? I'll need to put it... Is that OK? Not too sore? OK, that's done. All right?
Is it? Is it done?
Yeah, it's done.
That's incredible.
OK, stick that on there. Good, we're done. All right? Do you want a hand down? Are you OK? Sorted?
Thank you very much.
All right. But we might do it again if it does work and it wears off.
It doesn't feel like anything's different.
No, but it won't work immediately.
Oh,
Give it a bit
OK,
of time.
thank you.
Give it a bit of time. OK, then.
Chris Collins, please. Morning.
Morning, Doctor. Thank you.
Hi, have a seat.
Well, basically, the big reason I came in is for the results. Are they, for the scans? And they took me into the ring thing,
Yeah.
that you go in.
OK.
Yeah.
Let me just have a little look. I'll just get up those results. Well, the good news is that the scan is normal, and if you get more blood in the pee in the future, then we should send you back there. But at the moment, that's all that we need to do.
Right.
So that sounds like all pretty good, doesn't it?
Yeah.
And how's your mental health at the moment? How's that all going?
Oh, not too bad. Having moments when I sort of talk to myself a bit. Not answering myself, but...
Has that been stable in the background, or is that...
Yeah.
Yeah.
There is some times when, and I got... he comes from the Greenway Centre, and I talked to him about it, that sometimes I'll look at someone driving past when I'm on the bus and think there's someone I know, and it's just trick of the mind,
Sure.
But I think I have, at the station, actually seen a poltergeist,
Great, well, how are you?
What I've got is face ache and constant gunk at the back of my throat.
So the face ache, sinus there, sinus here.
Yeah.
You're talking about her mouth breathing.
Mouth breathing?
Yes,
Okay.
she continuously breathes from her mouth and not her nose.
I'm sick from the infection because I end up swallowing it, and the pressure behind my eyes and in my face is horrendous.
So can I feel on your face?
Yeah.
And is the stuff coming out of your nose?
A little bit, and when it is, it's like thick and yellow.
Come on in, have a seat. Right, Maddie, do you want to sit over there? Rio, you can come over here. OK. How can I help? So Rio suffers nosebleeds. Yes. Quite severely. Yeah. Through the weekend, he had 4. 2 were very, very bad, really struggled to stop them. I pinch it up here, it then goes down his throat. Yeah. And he spits it out. So I literally have to just wait for it to start congealing in his nostril. Yeah. He cries with them as well. I don't know whether or not they're hurting him. Yeah. Since then, he's been very lethargic, very pale. I don't know whether or not he could get anemic from that. I have no idea.
How long did they last for?
So the first one he had, that lasted maybe 2 or 3 minutes. And then a couple of hours later, about 7 or 8 minutes. That was quite a heavy one. But then the last one, the third one, which was sort of in the middle of the night, that was quite severe. It was about 10 minutes. Okay. And we're going through like
show me, Rio, show me what Mum does. Show me where Mum puts the pinching. Up the top there. OK. So you need to pinch much lower down. OK?
Ah.
So that bit there is a bit solid. You can feel it's a bit solid, yep. Whereas where it's actually bleeding from, almost certainly, is just inside. So what you need to do... Is it always that side? Yeah.
That side,
so if you had a cut on your knee, what would you do?
Why?
What would you do if you had a cut on his knee? Yes, so you go like that. So to put pressure on the nose, in that bit of the nose, you have to pinch the lowest bit, OK? But mainly it'll just make a scab, and that's what you need, is you want a scab, OK? So can I have a quick look up your nose? So if you just look up at the ceiling, very gently. And he's definitely got quite a good scab there now, OK? So the important thing is not to touch it at all, OK? It's quite common nosebleeds in the summer because the blood vessels get bigger anyway. What I would recommend is actually pinching for 10 minutes.
OK.
So the bleeding time should be 10 minutes or less. So by the end of 10 minutes, it should have formed a really nice scab. And then it just needs to be left alone. Are you happy with that? And, you know, you're nearly at the age where you might be able to do this pinching stuff yourself, to be honest. Yeah? Rather than Mum doing it. Yeah? Nah. Is that all right?
That's great. Thank you so much.
You look very well.
Thank you very much. Getting there.
All right.
Come on then, kids.
All right, kids.
Thank you.
That's OK.
Bye.
Bye now. Bye, Rio.
Well, I know that in the past you've had problems with, you know, ideas that have been difficult to explain, haven't you? And delusions that are linked to your mental health problem.
Yeah. One stage, a car went, this is a long time ago now, car went past, and do you know Data out of the Star Trek The Next Generation, the robot? I swore I saw him in the car, which was quite funny.
The mind does play tricks on people, doesn't it?
Yeah. And I actually, I do actually see them. You know, I do actually see, it's not as though I sort of, there's a blank space and I imagine something. I actually see something through my eyes, which is...
And that's what, you know, when people talk about hallucinations, that's what people, they're like. You know, they're really there for people.
Yeah.
And that's a really good description. So it's certainly not, nobody's saying that it's, you're not seeing it. It's just that that's part of the mental health issue, we think. Hallucinations are part of a group of disorders called psychotic illnesses, schizophrenia being probably the most common of these. For some patients with chronic psychosis, they don't have the insight that means that they can see the hallucinations and delusions that they're suffering are not real. And this adds huge challenge, as you can appreciate, to how we can support them and treat them. Fortunately, Chris is in a good place at the moment, and his medication is controlling those symptoms, and his hallucinations are something that he recognises, and so currently he has good insight into his mental health problems and how they're affecting him. We'll carry on with you being supported by the mental health team at the Greenway Centre.
OK.
And then I'll see you probably in 2 or 3 months if everything's going well. Super job. Well, nice to see you.
OK, Doctor.
Till next time.
All right.
Bye.
Bye.
Good morning. Your date of birth?
23rd August. 1953.
It's next week, my lovely. What date? You did it online. 12th, next Wednesday. Exactly the right time, but a week early.
Kirsty Winskill, please.
I like your doll.
Oh, thank you. Right, I'm Lizzie. I'm one of the urgent care clinicians. How can I help you?
We'll go with a throat infection. This morning my throat is bright red. My voice is gone. It's very painful.
Yeah.
I've got a friend's wedding to go to tomorrow.
Oh, no. No singing for you. Is it a church wedding?
No, manor house.
Still at the back, I just had to mime. Right, OK. Do you think you've had a fever at all?
Hard to tell, I feel hot. But
Yeah, it's pretty hot. Yeah. Not felt freezing cold, though?
No.
No, good. Have you been taking any painkillers at all?
Not yet today.
OK. So your temperature's normal, 37.2. That's good. Let's have a look in your throat, then. Stick your tongue out for me. Nice big ah. So it's quite red. Your tonsils don't look... Yeah, your tonsils don't look too bad. Let's have a feel of your throat here. Is this sore?
The art there, yeah.
All over. Quick look in your ears. Have a stand up for me a second. OK, turn around. Let's have a look in this one. OK, so your ear canals are a bit red, both of them, and your eardrums look absolutely fine. So I think it's probably a viral sore throat. There's no pus on your tonsils. Your temperature's normal, which is good. With tonsillitis, There's two types, there's viral and bacterial. Viral is just really annoying, we can't do anything about it. It's just a case of just waiting and painkillers. I think just, are you off today or have you got to go to work?
In work.
So just a case of rest as much as you can tonight, early night, painkillers, paracetamol, ibuprofen with your food, and the throat spray if you want to get some of that from the pharmacy. Okay. Loads of water, and try and avoid alcohol tomorrow. But other than that, have a fabulous weekend.
Try to.
All right.
Thank you very much.
See you later. Bye.
There's a lovely handbag here. Take care.
Thanks very much.
Bye-bye. Thanks.
Tidy up, Father. Tidy up.
Don't worry.
Okay, thank you. Bye-bye.
Okay.
Thanks.
Bye-bye. Thank you.
Tidy up now.
Batman? Yeah, OK, brilliant. Oh, I lost 4.5 pounds at Slimming World. Well done. Don't look at the fridge now, then. No. OK, bye-bye.